From x-rays to MRIs, mammograms, well, there are all sorts of tests you might end up having to get at some point in your life. Radiographers do play an important role in keeping us all healthy. Denise Benton is with us from the Toledo Clinic to go over some services they offer. Welcome, good to talk to you. I love medical interviews. So you're a radiological tech. So you provide a lot of services when people come in there. What all different devices do they have? There's MRIs, there's CAT scans, everything.
Yeah, I'm a radiological tech or X-ray technologist.
Yeah.
And we play a very vital role in medicine. We're kind of like the eyes. We see, we gather all the information for the physician so he can make a diagnosis, treat the patient, and restore their health. Several services we have at the Toledo Clinic. We have the state-of-the-art equipment, of course. We offer X-ray, fluoro, ultrasound, CT, MRI, nuke med, and PET CT, DEXA scan, which now we're doing BMI, body mass indexing. So if you're a CrossFit enthusiast, you can have that done. And then our mammogram machine.
Medicine evolves so fast. What have you seen just in your career on what more is available and how remarkably better it is at detecting anything?
Right. A couple things. One, with mammograms, it was 2D. Now it's 3D. With a mammogram, it's like looking for a white bunny in a snowstorm. And with the 2D, it was really hard. With 3D, it's more like a slice of bread. You can take each slice out and look at each image individually. And also, for the radiologists, the AI. That's something that's pretty impressive. The CT is so much faster, the MRI. When I started CT, we would, it would take a half hour for a brain. Now it takes less time to get the patient on and off the table.
AI, yeah, it's to an outsider, it's kind of frightening now. If you're working with it every day, you're probably used to the benefits of it. What have you seen?
I can't really talk more on that because that's more on the radiologist side.
Yeah.
Now with our radiologists, they're all board certified. Our report time is phenomenal. It's 24 hours or less. The radiologists are in-house, on site all the time, along with, they live in this community. Along with the technologists, they're all board certified. So if you're in CT, you're board certified in CT. So you know everything there is about it. Very high skilled. Their quality of work is phenomenal.
A lot of the testing too is, in the past was always after you were already sick, let's see how bad it is and what's going on. But the beauty of it now is it's used for prevention. For example, you have lung cancer screenings, you have mammograms on a regular basis. I mean, that just makes such a big difference in people's health. Right,
exactly. And and sometimes you have anxiety when it comes to X-ray, anything. So our technologists are so compassionate. They're very professional, but the compassion we show there, we take the time. We don't have to do every 15 minutes. We're very, very sensitive to people and how they feel and what we can bring to the community.
Well, we talk bedside manner with doctors, but it's important for you because you're more boots on the ground with the patient. And if someone comes into you for a mammogram and they're really nervous, they found a lump, and it's all on how you treat them and how have you learned to evolve and help take care of people?
Well, it's when the first time baseline, the woman that's going to have a mammogram for the first time, I really take the time, sit down, compare her mother's mammogram to the mammograms nowadays, which are so much faster and high tech and not as compressed as hard. And then we give them a rose for their first time mammogram, saying, welcome to the club, and we'll see you next year. Same with our biopsies. Every modality that does biopsies really takes the time to make a connection with that patient one-on-one before we even start the exam.
Where are their facilities with Toledo Clinic? Where can people get these access to the tests?
Yeah, good question. The one in Maumee is off Anthony Wayne Trail.
Okay.
The one in Toledo is on Secor, and then there's one on Holland, Sylvania.
Yeah, and so a lot of these are walk-up, or do you need to call ahead and get an appointment?
X-rays, you just walk in, no appointment needed. The other modalities, it's 1 to 3 days to schedule, and that's because of the pre-certification and or the insurance.
So your specialty is with mammograms.
Correct.
And what's remarkable is the treatment for breast cancer has come so far in a very short period of time. But the beauty of it is we have more potential to do so much more in the coming years.
Correct.
Denise, thank you so much for coming in
Oh,
today, talking
thank
about
you.
some great things at Toledo Clinic.
Yeah, thanks for inviting us.